We hold these truths to be self-evident, that all are created equal, that all imbued with the right to life, liberty, and the pursuit of happiness. These words point us in the right direction because we're here to focus on life. Statistically speaking, 3 babies around the state of Ohio are going to die today. 3 babies died yesterday. 3 babies are going to die tomorrow. And if you're feeling some sympathy, feeling bad about this, you should, because this is a tragedy. Ohio has one of the highest infant mortality rates in the entire country. Infant mortality is defined as babies who die before their first birthday per 1,000 live births. Ohio's infant mortality rate, around 7. 7 babies die per 1,000 live births every single year. But this doesn't get us to the entire tragedy because there's also a racial disparity. Black babies in the state of Ohio die at the rate of 14 per 1,000. White babies die at a rate of 6 per 1,000. Black babies account for 18.5% of all live births around the state, and yet they account for 33% of the state's infant mortality. And so I do a lot of work around the state, working with health equity coalitions, with doctors, with social workers, trying to figure out how do we answer this problem? What can we do about it? We spend billions of dollars around the state to try to affect the top 4 causes of infant mortality. One is sudden infant death syndrome, another preterm birth, another congenital anomalies. And so as I was driving and I was thinking, one of the things that struck me is that these things don't cause infant mortality. These things cause infant death. And so if what we're focusing on is how do we stop people from dying, then we've caught ourselves in a rhetorical loop because death is a part of our life. What we have to focus on is expanding our sight outside of death and into life. And so it's not necessarily intuitive how we move through this framework from focusing on death to focusing on life. Officials in the field of public health have created a framework for us that's going to allow us to understand what's happening in a community. Not just why are babies dying, but how do we promote life? This framework is called the social determinants of health. Social determinants of health broadly include the built environment, education, personal finance, social network. And it's through these social determinants of health that we're able to understand what the built environment looks like, what the social environment looks like, and how those combine to affect the health and healthiness of an area. So let's take a look at this. We'll take a look at 2 communities, Community A and Community B. Community A has an average median income of $19,000. Community B, average median income of $90,000. Community A, 40% of the people that live there haven't graduated from high school. Community B, nearly 100%. Community A, crime rates, including violent crime, property crime, all above the national average. Community B, crime rate, virtually non-existent. So if the question that you're asking yourself is, I wonder which one of these communities has a higher rate of infant mortality, probably going with Community A. Infant mortality rate in Community A is between 14 and 15 kids or 14 to 15 deaths per 1,000 live births. 14 to 15. Community Community A, infant mortality rate between 1 and 2. Over 14 times higher, right, in Community B compared to Community A. And so if you want to know where these communities are, when you leave, take a trip down Broad Street, heading east outside of Columbus. When you reach Community A, you'll know it because you're in Old Town East. You reach Community B, you're going to know it because you're in Bexley. And so you know what separates these two communities? A street. Less than a mile. If I was feeling poetic, I might say something like, I'm sick to death of this. But this isn't poetry, right? This is tragedy, and this is real. So I've provided the statistical landscape for you, provided a bit of the social determinants of health, because now the attention turns to you. What can we do here? So as I mentioned, social determinants of health include personal finance, the built environment, education, your social network, and one other additional one. And so what I want to focus on now is the social network. And so if we understand that 70% of every single health outcome is related in one way or another to the social determinants of health, then here we have an opportunity to leverage investment. Rosa Parks was a seminal figure in the civil rights movement. We have extolled her virtuous character. We have chronicled her strength. Rosa Parks, amazing person. One of the things that we don't talk about, though, is Rosa Parks' network, her personal network. Rosa Parks knew people from different races, from different industries, from different socioeconomic statuses. And so when Rosa Parks was arrested on the bus, regardless of the fact that this had already been happening to people, regardless of the fact that people had died because they wouldn't get off the bus, Rosa Parks' network looked at her and they said, this ain't gonna fly. Not with Rosa, not with her. They were able to extend their empathy beyond what was familiar to them. And it's through that extension of empathy that they were able to motivate, they were able to actualize their energy and do something. Sympathy for Rosa Parks would have left her sitting in the jail. Sympathy would have said, I'm sorry for the situation you find yourself in. But empathy makes us act. One of the things that all of us can do when we leave this room is go out and act. Go out and work to build a new network. So what does this look like? First step, empathy. Empathy is the bridge that connects us to other people. Empathy is the bridge that connects us to different ideas. Empathy is the bridge that connects us to our humanity and our spirituality and provides us the space to grow. If we don't have empathy for people, we can never have that space to grow. Put yourself in somebody else's shoes. Try to understand what that feels like. Next, what kind of currency are you going to spend? So one of the things I mentioned was that there are a number of ways that we can invest in infant mortality outside the causes of infant death, right? But that takes currency. Is it going to be transactional currency where we say to ourselves, I'm not going to do anything because I don't know if it's going to make a difference? I'm not going to get out and go meet somebody new. I'm not going to go extend my network because I don't know if it's going to work. That's not good enough, right? We need transformative capital. We need transformative currency. We need people that are going to go out and say, I don't know if things are going to change. I don't know if I'm going to be able to help affect this situation, but I do know that there is a particular area that I can invest in. Transformative currency isn't what you take with you when you leave. Transformative currency is what you leave behind. So we can extend our personal networks in a moment. I can't tell you all how many times random people have come up to me and they've just said, smile. They didn't know what I was going through. But in that moment, they were able to put themselves in my shoes, extend that empathy. Or you can volunteer somewhere at a shelter for battered women, at a shelter for homeless teens, at a center for kids. It doesn't matter. The data says that no social determinant necessarily has a greater impact on the overall health of a community. And so that means we can start anywhere. One of the folks that you've heard today has a great example of this. There was a homeless individual who needed a job. This gentleman asked himself, how can I extend my network? What can I do? And in less than an hour, this gentleman had 5 job offers. Less than an hour. This is how easy it is. This is how we can leverage our personal network. And so what do jobs equal? Job may equal personal finance, right? Social determinant of health. It may help him get into some housing, social determinant of health. It may help him get health insurance, social determinant. Who knows where he may live? Social network might be good, social determinant. And so just in this one way, right, we can see how we can leverage a single social determinant of health to affect a broad category of things. And so what I want to leave you with today, I'm not asking anybody to go out and try to save the world. I mean, if that's your thing, I'm not going to stop you. Go for it. But what I'm asking you to do is figure out, how do we extend our empathy? How do we spend our transformative currency? And the result is not that you're going to change the world, but maybe you can save a life. Is it worth it? Thank you.